Hi there, and welcome to our webinar. Today we are with Ask the Vet with Dr. Tom Tully. Welcome, Dr. Tully.
Well, thank you, Laura, and always happy to be here and also get the questions so we can discuss them and see what kind of information that we can possibly provide and learn a little bit where everybody learns.
Yes.
You and I and our attendees.
All right. Well, let's give a few seconds. Well, let's give a minute for people to come in. I'm going to ask you a question that I'm recently recovering from a pinched nerve, which is like, I have to tell you, it's not fun to have a pinched nerve. So my question to you, not about my pinched nerve, but I know how do I get rid of that?
See a physician.
I know that I think dogs can get pinched nerves. Can birds get pinched nerves?
Sure.
Is that something that you they present with? Is that something that would be diagnosed? Is that something that's treated?
Well, it's difficult. Any type of neurological problem is difficult to diagnose in birds, or any animal. There you can suspect that you have some type of a neurological issue. And the bird may be feather picking at the area because it bothers them, or traumatizing the area, or I shouldn't say feather picking, right? Feather destructive behavior, excuse me.
Okay.
But there can be some kind of focal issue, or there could be some disuse of that appendage if it's a wing or a leg. But it's difficult because, of course, some birds could possibly verbalize that, but for the most part, not. And so it's always easier with neurological issues to try to have a description of it, as opposed to trying to develop a diagnosis just based on what the bird is doing, if you follow me.
Yeah.
And then trying to get a diagnosis of that is even more difficult, because then there's nothing really that you can do. There's some muscle neurological where you can EMGs, they call them, where you can have electrodes to determine if there is neurologic function. But for a pinched nerve, you see, it's rather difficult to because the muscle and nerve would be working, but it's painful in that area, and so. But yeah, birds could get it. Because most of with the anatomy, they have vessels, they have nerves, they have muscles. So just about anything that we get, birds can get, because they have they're built of the same structures.
Yeah.
So keep that in mind. They can have have ligaments. They have torn.
Torn muscles.
Athletes get torn knee ligaments, and birds can get that too, and they can have dislocations, and of course the fractures, everything that's obvious. But it even goes down to some of the neurologic issues and hormonal issues, and those are behavior issues, as a lot of these webinars have discussed. And you can see that when you get into hormonal behavior, neurological, those are really difficult to pinpoint. And even if you do diagnose it, sometimes very difficult to treat, but at least you know what the situation is.
That's fascinating. Yeah, that would make sense.
Wow.
Well, if you're just joining us, you're at the Ask the Vet with Dr. Tom Tully webinar. And just a friendly reminder to use your Q&A button, use the Q&A button and not the chat feature if you have a question for Dr. Tully. So, Dr. Tully, I'm sure we're gonna have a lot of questions today, because that's what we do on Fridays with you.
Well, there's we've had many cases coming through as usual, and as I always say, it's never dull. It's never Well, we've seen, it's just typical. We have some typical cases, but they often are individual. The patient is showing clinical signs, or they have a disease condition that's somewhat different than others have had. And then we have some very unusual. We've had some couple of cases that older Amazon parrots that have had fluid around their heart, and we've done some echo ultrasound of the heart, and some examinations, and it's always amazing to see the expertise. And it's one of the joys of working in an institution where you have specialists, and to see the cardiologist be able to stick a needle into that the sac surrounding the heart and collect fluid from that, and then from that fluid you can sometimes you can get a diagnosis of what's causing that fluid to be around the heart. So as I say, it's always interesting, and some cases don't turn out as well as you would like, but it's medicine, and do the best to make sure that the patient gets the best care.
Wow, that's why we're here. That's why you're here. Let's see. I have a question from right off the bat for you from Sue. She has a 15-year-old female cockatiel. More than likely has the avian virus due to neurological issues and total blindness. Her forever mate most likely has it due to his symptoms. So her question is, she has started eating her droppings. Sorry, there's a heavy vehicle going by. She still continues to eat and drink as normal. Any ideas of what that could be?
Well, the first thing that's mentioned, a 16-year-old cockatiel in my book is an older cockatiel, and of course there's some various I guess thoughts on what an old cockatiel is, but as we've talked about, the average expected life expectancy of a cockatiel, I think if they get to 16 years, that's fantastic. Of course, we've had some in the upper 20s, but so you say you have a blind cockatiel. There's a blind cockatiel with what kind of neurologic signs?
Says that he has she has the avian virus due to neurological issues and also total blindness.
Okay, let's stop it right there. She has the avian virus due to these signs. I think for the first thing that we can just say, we don't know if she has the avian virus, whatever that may be. Okay, neurologic signs, you don't know if you have any disease unless it is definitively diagnosed. That's the one thing I think that should be a takeaway from this question. Unless it's definitively diagnosed, then I don't think that there should be any assumption that the bird has this specific whatever virus it is there. So that's the first thing, because there's a lot of different conditions, especially in older birds, that can cause neurologic signs. And as far as blindness, you can check the eyes on the bird when you get older. People, when I say you, I'm talking about people in general here, get cataracts. There's cataract surgery, have lens replacement, all of this good stuff now, but it affects your eyesight. Animals with lenses in their eyes, as they age, get these lens opacities that cause them to go blind. It's possible that this cockatiel has that, if it and should be checked. But because one bird has this, is showing similar signs, there could be other issues that actually are causing this both birds to have this clinical signs, and it's not necessarily the virus. So it could be some type of a virus, but I wouldn't go there unless it is definitively diagnosed. Now, then you have the issue of eating the droppings, and of course that's usually not something that you would really encourage on that. And that's the same thing. You don't want to have a water bowl under where the bird perches, or it's on the side of the cage and poops into the water bowl, and you get poop soup. You don't want that. And no different than you want the bird eating the droppings. And so you go like, well, why would the bird eat the droppings? And one of the possibilities is that there is a condition if the birds are lacking nutrients, that there may be something that the bird feels like it's picking up. There's the birds. I mean, most people have heard about the birds in the clay licks or the clay deposits, and where the birds is called geophagy. And so geophagy is eating of the earth, and some people do that. Coprophagy is eating of the feces, and so the stool. So that's what this bird is doing. But it may be, again, look at the diet and try to make sure that there is a calcium source within the diet, and that you have a proper diet for the birds, that it's obtaining the minerals and nutrients that the best that we can determine that the cockatiel. I think Tom Rowdy-Bush has done some studies on what the nutritional requirements of cockatiels, and maybe somebody else. Mm-hmm. And so I believe we do know that. And so there are formulations that for the cockatiels that should meet those requirements. But that's one of the reasons I think that the birds may be eating the feces, is that they're picking up something in the feces that they may be missing within that diet.
Okay. And Jane wanted to know, should probiotics be given during a course of antibiotics, or should you wait until the antibiotics are finished?
Again, this is something that is, we've talked about the probiotics in previous webinars. And I'm a proponent of probiotics, although there isn't a lot of, there is very little information on the effects of the commercial products out there. Okay. And so, although I'm a proponent, because theoretically they should be very beneficial. And so if you do give a commercial product, I recommend the gel form of the commercial product. And I would say to give them during while the bird is on antibiotics, if you're going to provide probiotic supplementation. And not everybody does that, but I don't think it's going to hurt the bird whatsoever.
Okay. Okay, we got a longer question from Cheryl. She has, well, actually 2 questions about her rescue blue and gold macaw.
Okay, let's start with the first question.
That's a great suggestion. So first question is, so he's almost 20 years old, and obviously plucked under his wings and near his feet in the past. While he hasn't been doing that, he does turn the top part of his wing backwards, clips off a few flight feathers, and uses them to scratch his head. Sometimes he gets mad at his own wings after this and growls at them. Is this a problem?
What does he do to him?
Apparently after he does this, he sometimes gets mad at his own wings and he like kind of growls at his wings.
Oh, okay.
So they want to know, is this a problem? And then they try to distract him when they see it. And the vet told him he has, okay. I think this might be the question. Okay, so there's question number 2, just to give you a preview, is the exotic vet told us he has bumblefoot stage 1 and his feet always look sore. Is that okay if it doesn't get worse? So one about the, the plucking of the feathers on the flight to give him a head scratch, himself head scratches, and then the bumblefoot. I think those are the 2 questions.
That's an excellent question. That's an excellent question. And birds never cease to amaze me. They really don't. They are fantastic animals and do things that sometimes I scratch my head with my feather. With this, it's an unusual situation, and I tell you that I'm just thinking here that there's only so many feathers. And so if he does this very irregular, that I don't think that that it is a problem. I do believe that if you had to make sure that this bird, this would be something along the lines like a Chris Davis would, as far as the bird kind of interacting, because the bird doesn't need a feather to scratch its head. We've all seen the bird put their foot on their head and rub their head just like that. So it doesn't need the feather to do that. But obviously for this bird, that is one of those, it seems to be something that it does. So what I would say is I don't believe it's a significant problem, because he wouldn't have any feathers if he did this every day on the wing. There would be no other feathers to pick. So my thoughts are that I would try to encourage more interactive, more interaction with the case, more psychologically stimulating items within the cage that the bird would possibly kind of be able to interact with, to kind of divert some of this his attention away from the feathers, and possibly this is kind of an issue where the kind of a boredom issue with the bird. So that would be, but this would be something that I would possibly ask one of the behavior people on the webinar. But if he still has feathers and does this from time to time, then I don't think it's that significant of an issue. But by diverting its behavior and more interactive items within the cage may be helpful on that end. Now with the grade 1 bumblefoot, what that usually is in the grades, depending on what you're looking at. Now, bumblefoot is just called in kind of pododermatitis, or it's inflammation of the bottom of the foot, for anybody who's not aware of that. And there's different grades of that. And so the first grade, if you have, just say, if you see the bottom, it's kind of a pebbly, roughened appearance on a normal bird foot. That's how the skin looks on a normal bird foot. Well, a grade 1 bumblefoot is usually where you have that pebbly appearance, kind of smooth. It's smoothed out, and you don't have that pebbly, roughened appearance on the bottom of the foot. So that's kind of a grade 1 bumblefoot. That would be classified as that. Now, as the grades increase 2, 3, 4, 5, and I think that some people have said there's 7 stages or grades of it, or 5 stages. Well, what that means is that smooth appearance sometimes will crack. In what causes bumblefoot? Well, bumblefoot for the most part is caused by pressure on there's skin and little fat pads on the bird's bottom of the feet. So there's not much there. There's not like a cushion of fat on the bottom of the foot. So the bird's going like, oh, this is so nice. It's so nice and like a comfortable shoe that has a lot of foam in it. There's not a lot of foam there. So if a bird is just sitting in the same place every day, what happens is that they get pressure from the body on the feet, and that causes that to get rub and the pressures, and it thins the skin on the bottom of the foot. And so you don't have the blood supply going into that area. And so that thin skin is what it kind of is not as alive as it should be. And then it cracks. And so your barrier between the environment and the inside of the body is broken. And then it allows bacteria to get into that area. And then sometimes it can get infected and inflamed, and the stages go up from there. You go stage 2, stage 3, and then if there's an infection in there, they call it infectious pododermatitis, then it gets into the bone of the toes, or the foot. And that's like the highest stage. And this can actually result in disuse, and it can result in even amputation. So you want to try to prevent the birds from getting bumblefoot, and that's to maintain a good body weight so they're not overweight, and then also provide perches that are that are natural wood perches, as the birds would normally perch on. And what's the benefit of natural wood perches? The benefit of the natural wood perches are that they have various and differing diameters. So it's not the same spot on the foot that the bird is always perching. If it perches on a branch here that's this diameter, well, this part of the foot's actually bearing the weight. And if it goes down the branch out from the tree, it's going to be narrower. So you're going to have a different part of the foot bearing the weight of the bird. So natural wood perches are one of the best recommendations to try to reduce the development of bumblefoot lesions on that. So there you go.
All right. And Christine wanted to know what can cause changes in AST levels. She has a sweet 8-year-old cockatiel. Squeaky Cheese was showing an elevated AST in the 600s. He was put on antibiotics in case of liver infection and dropped to 400 after 2 weeks. But then he went back up to 600. They switched to antibiotics, but he's still around 600. And the vet thinks it could be hypertrophic cardiomyopathy. I hope I said it right. So if you have advice on that, on dealing with uncertain diagnosis, and Squeaky Cheese is not showing any symptoms and is happy, however, and anxiously. So Squeaky Cheese, by the way, that's a great name. So sorry, but let's see what's going on with Squeaky Cheese here.
We have to give credit where credit's due.
Yes.
And I love it. I love it. And of course, that's an excellent question, because I always say that when in talking to owners, and I always say, well, when I'm talking to an owner, I'm talking to myself, and I'll tell the owners that I'm saying, I'm telling you what I would want to hear, you or me. And so, you know, a lot of times it's say, oh, well, we want to do blood work. And it's like, well, what's blood work? You know, you have an idea because most people have had physical exams, and we've talked about this, and you go and get your blood drawn, and the doctor talks and says, well, you have this or that. But in most cases, we're talking about 2 blood tests: the complete blood count and the plasma or serum chemistry panel or biochem panel. And the complete blood count it involves what the packed cell volume, or the red blood cells, the percent of red blood cells, and within the sample. And then you have your total white cell count, and then the different white cells that may show inflammation. Now your serum biochemistry panel has a lot of different analytes: your glucose, your calcium, your phosphorus, and it also has enzyme levels. And I think AST here is one of them. I think you have your ALP, another enzyme level. Your creatinine kinase is another. That's within this biochemistry panel. Now, what the question was is this AST is an enzyme that's measured, and the cells, if they are affected, let's just say that, can release this enzyme. Now, the problem with this enzyme is that there is, and it's a good question, is where can this enzyme come from? For the most part, you're looking at muscle, and then you're looking at liver tissue. And so and often you know, I don't have the you know, as far as the case, this is one little specific part of the case. So so I don't know much, hardly anything about it, but just this talking about AST, the muscle and liver. Now, one of the muscle enzymes, the creatinine kinase, is something that really can affect the AST level. And so if you have and so that's fairly muscle specific. So if you have a high creatinine kinase, then that's going to affect the AST level. Now, if it's normal, then it would be less likely that it would be muscle involvement, and it would be more liver, especially if some of the other enzymes are elevated within this panel. So there are, you know, it's not a liver specific. One thing that maybe a suggestion is to run a bile acid for liver function, just to see if that's if you know where that would be to determine just the health of the liver on that. That's more liver specific, and a bile acid test is can be determined, and you can get levels there and see the significance of maybe that AST. I hope that wasn't too convoluted or complicated, but it tried to go down a path toward something.
That was good information. Very well explained and in depth. So next question is from April. A Senegal parrot is currently having difficulty with chronic, Clostridium. Is that right? We've tried metronidazole.
Metronidazole.
And this word you're going to have to help me with too.
The Senegal parrot possibly has a Clostridium infection.
Yes. And so they tried the metronidazole
metronidazole.
And then the azithromycin. Azithromycin?
Azithromycin.
Thank you.
Azithromycin.
Azith with a Z, yes. It doesn't seem to completely be cleared. And she's also on Benebac. Is any research being done on parrots' microbiome? Is there anything else that she can give them to boost the gut health?
Okay. So there's I guess what we would look at here is that there's a clostridial infection. I would, based on this, there's an assumption here that it's within the GI tract, the intestinal tract. And so the bird, I'm again assuming that it has some diarrhea or some type of clinical signs of disease, and that they the only thing that I'm not going to assume is that that a culture and sensitivity was actually run on this bird, that it was not obtained, because you can sometimes pick up clostridial organisms within the gram stain of the fecal material. So I would first of all say that if a culture and sensitivity was not performed on the bird, then that should be done if there are clinical signs that are associated with the clostridial, possible clostridial infection. And then what that would do is that if it was identified, then they can run a sensitivity, an antibiotic sensitivity panel to determine, And I did see that they had difficulty growing the sample in the lab for sensitivity testing. And then that makes it difficult, because I can tell you that we have had a number of organisms, and we see, and this is in birds and other companion exotics within the last week. And I was making this statement this morning that we have seen some high, organisms this past week. It just is one of those I guess it's one of those points in time where it seems like just about every culture that you and organism that you isolate comes back with extreme resistance to the panel and intermediate. And so the problem is that with that, when you try to select an antibiotic, and if you had a panel and it was only sensitive to like 3 drugs, you would have to get lucky. Like I don't know really, I don't, if you don't have that sensitivity knowledge, then you select, and all of these are good antibiotics. But if you don't know what it is, then then it's, your odds are not very good when 3 out of 20 are the only ones that are effective, right? And so you're treating with antibiotics, and that is making sure that the animal is getting the dose that's required at the time that's prescribed. Then, it's not, you don't have a very good, you're not going to get resolution, and it's just going to kind of perpetuate. So my thoughts are that it's possible that the antibiotics just may not be effective on something like this, and it's not. And if you're still having the clinical signs, then it's not out of the question to try to see what you can do to increase the chances. Talk to the lab, or have the veterinarian talk to the lab to see what we have this clostridial organism that is not responding to treatment, and we had difficulty growing it up. Is there anything that we can do to try to improve the chances of growing this organism? Because that sensitivity panel is going to be so important. And then as far as the Benebac, that's helpful. And as far as the microbiome studies, none that I'm aware of at this point. Most of I think most of the canine microbiome studies were probably funded by some of the larger food companies, and there's really no such funding or return on that funding for unfortunately for avian species. And you have to remember the lovely aspect of what we're talking about here. When you have one species, canine species, and basically one feline species, but how many bird species do we have? So we do the microbiome for the cockatiel, but that's not the same microbiome for the blue and gold macaw, right?
Good point. Good point.
So how many microbiome, that's a great question, and then therein lies some of the I guess questions as far as the true ability of probiotic supplementation, because when you're talking about the probiotics, what is generally thought is that the probiotics work best when it is species specific, not if you're using chicken probiotics in a hyacinth macaw or a green cheek conure, and so so what we hope is that there is some benefit on that. It doesn't appear by any means to have any negative effect that I'm aware of, but at the same time, there's no real I guess scientific evidence that the products that are available or how well they'll work.
All right.
How's that, Laura?
That was good. That was very, very in depth again. We're getting a lot of getting to the heart of all these issues really deep.
Yeah, it's frustrating. I know it's frustrating. The one thing that I can emphasize is just make sure that when a treatment is prescribed, that do your best to make sure that it is given as instructed, and that the animal is in fact getting that medication, and you go through the treatment protocol till the end. The bacteria and fungal organisms, they don't care.
Yeah.
They are 24/7 they're fighting you. And so you have to fight harder than they do. And they don't sleep. Okay. And so if the treatment isn't getting in, it will not be effective. And the animal will not recover. And so and that's what you could do on the owner end. But and then if that's the case and everything on that part's good, then it's time to say, hey, that isn't working, and why not? And if you have an organism in place, the lab can sometimes be helpful in trying to increase your chances of getting the results you want. So just ask them what you can do to help them.
Okay. And then the next question is from Caroline about a 5-year-old budgie that's in great health, but seems to be suffering from inflammation of the liver. His vet felt inflammation and his breathing was cackly. He's also been taking
What's that? Wait.
I'll slow down.
So the inflammation of the liver?
Yes. And then he said that the vet felt inflammation and his breathing was cackly. He's been taking 2 different antibiotics for about 6 weeks, and he's seen there's improvement, but his last follow-up visit, he was the wheezy sound was almost non-existent. So the vet recommended he stay on the antibiotics another 2 weeks. Other than a good varied diet, are there any other supplements that you can give this bird to keep his gut clean so there's no more future trouble? So the budgie has the inflammation of the liver and had that cackly sound that seemed to have gotten better.
I don't know what that sound is.
I think, or maybe a wheezy sound, because then the follow-up visit, the wheezy sound went away. So let's assume it's a wheezy sound.
Okay. And again, when we and everybody who's on who attends the webinar, it's one thing to know that the questions are fantastic, and I'll address those as and try to answer and give you my thoughts and on that may be helpful and informative. The one thing that I don't have is the complete history, and I know all of the veterinarians out there are doing the best that they can with the cases that they have and that you see, and so with this case, I'm not sure where the inflammation of the liver is coming in, and then also you have, on top of that, you have a respiratory issue. So you have liver on one side and respiratory on the other. And so you look and you say, well, what? And you say, I have a 5-year-old budgie here, and not sure exactly how long it's going on. And again, as I mentioned, it's extremely difficult to try to identify inflammation of the liver in a budgie without some other evidence. And one without any diagnostic test. We mentioned enzyme levels, but you look at most budgies, they're between 30 and 40 grams. And so you can only, if you had a vet scan, an Abexis vet scan, you could use 0.2 ml of blood, and then you could get a biochemistry panel that would have some enzyme levels and a bile acid to look for liver function that may indicate objectively that you do have a inflammation or possible liver inflammation or something, hepatitis, which was liver inflammation. Another issue is the possibility, if you don't have any tests that would substantiate that, then sometimes if the stool is green, and that would be, or the urates are green, giving the little budgie stool that looks like a bullseye sometime, that it would be kind of a greenish color. And then what that would normally be is that that would be sometimes associated with biliverdinuria. And biliverdinuria, birds don't produce the bilirubin, but it's kind of that's the byproduct within the liver. And if it's actually if there is a greenish stool, or if there's a inflammation of the liver, hepatitis, then you can have this biliverdinuria, greenish stool. It doesn't point to anything in general, but inflammation of that tissue. But so that may be what's they're going on if there wasn't any test. Now the respiratory, the kind of the sound that they make, as I saw where there's that the stethoscope. Sometimes it's difficult to hear through a stethoscope that the crackling sound, because birds don't have alveoli. They have air capillaries, and the air flows through. Some of the sounds that physicians hear when they listen to our lungs is because we have these little air sacs, these dead end air, the alveoli, that if they don't open, or there's difficulty opening, that they could hear these crackles, and so you're gonna kind of feel them. But birds don't necessarily have that. You can hear the audibly if you put the bird up to your ear. I can hear a bird having difficulty breathing. It's possible that the veterinarian did hear that, but how that relates to the hepatitis is unknown on that. Now, the question on this 5-year-old budgie, where liver can involve respiration, is if you have a liver mass, if you have an increased size of the liver. And then what that does is that reduces the bird's ability to breathe, because it's taking up space in the body. And birds have difficulty breathing if there is a mass in the body. So the bird's little tail will be going down like this. And so that would be indicative of the bird having difficulty breathing. So that's my thoughts on that, Laura. I'm not sure how the liver is involved, but there was one question at the end of that, I think, maybe.
At the end of it, it was about the diet. Is there any other supplements that she can give the bird to keep the gut clean, so that we don't future problems?
No, and I don't really see anything like where there would how that would be involved. Just good nutrition on that.
Okay. And then we have a question from Gail. Has an adopted lovebird, so they don't know the age or the sex. The bird's head droops down and to the left. Seems healthy otherwise, but what does this mean? What can it be? The head's up, down. It says upside down head mean. What does an upside down head mean?
You know,
Yeah.
and I guess I would assume that it would be all the time. You know, that the head is always kind of tilted or to the side, and what that could be is anything. We've had neoplasia. We had a little. It was either a parallel or a little parakeet. I can't remember exactly what type of parakeet, but it was it had a head tilt off to the side, and it was a generalized cancer. It wasn't, you know, you think, well, the head's tilted, it must be a brain tumor or something, but it was more of a generalized, and it had difficulty seeing on that. And its eyes were, I think it was a Bork's parakeet, and then it had its eyes were kind of difficulty opening its eyes, maybe light sensitive. So that is, and then of course you have where it could have been traumatized, that would have caused that some kind of a brain injury. So that is a definite possibility on that. So those are probably the two most common reasons that something could occur. Of course, you can go down into that there could be some type of inner ear issue or some type of an infectious process that's causing this, or inflammatory process. But I would say either trauma or the possibility of even cancer.
Okay. And then Linda has a 14-year-old cockatiel that's been molting a full month. Does this seem right to be molting this long for a cockatiel, like about a month?
Yeah. What you have to realize, and that is an excellent question. We've had excellent questions as usual today, but it's a process. It's a process, and when you say molting a month, you know, there's feathers coming out, new feathers coming in, but a month is not out of the ordinary at all. You know, when you hear something like that as a question, I'm thinking like, well, the bird lost all of its feathers. It's a naked bird there, and then it hadn't grown them back for a month. But we all know that the birds don't lose all their feathers. You really don't see, there's not a featherless area on the bird unless feather destructive behavior and it's doing it to itself, or a cage mate doesn't like it and it's doing it. But for the most part, those feathers are molting, and they'll lose feathers as you know throughout the year, but in certain times they'll lose obviously a significant number more, but no, that's not unusual.
Okay. And then Amanda wants to know if it's okay to give her adult conure KT Exact hand feeding formula every day. Her feathers have gotten much better now, and she's no longer plucking. She got her as a rescue, and she won't eat the best diet. So can you feed a adult bird hand feeding formula every day?
Well, I mean, there is no reason that you can't do that. None. And actually, we that is our recommendation. We had a little conure, Boots, that was here at LSU that had the upper beak cosmetically removed by another bird.
Oh,
And so there was no upper beak on Boots. And so this was a little sun conure, and Boots was like a kind of a mascot. And for open house, we could take Boots, and we could guarantee Boots wouldn't bite anybody. And so didn't have an upper beak. But Boots was fed the hand feeding formula for years, because that was, and of course, and you can also, grind up regular pellets and or moisten regular pellets, and birds in that type of situation would do well. But Boots, I know, ate the hand feeding formula. But I would recommend having, you can provide that as a supplement if the bird likes it, but to have other food in there to provide a variety if it'll eat that too.
okay.
But in general, you could.
Interesting. I mean, as far as oh, okay, sorry. Just so we can get to Glenna's question. She's a total budgie fan. What do you see as the most important research area for improving the quality of life for the many pet budgies out there, the little guys?
Yeah,
little underestimated little guys of the pet bird.
How to keep cats away from budgies.
Yeah.
Yeah, I saved one of mine the other day. I got him into that trouble anyway. But no, I would say that for the most part, there is nothing really specific that I could say that for budgies that would improve their ability to that would make a significant difference at this time in their for their health care. Okay. But what I would say, if I had if it was just like I had a genie in a bottle and I had wishes, if it would, and so we could go there, I would say as far as the with budgies, the biggest issue we have is the cancer in budgies. Budgies are very prone to cancer, and if there was anything that we could do either for the treatment or try to look and see why they are so predisposed to this disease process, and is there anything that we could possibly do to reduce the number of cases that we see in these little guys, I would that would be my wish. But as far as the research and healthcare on budgies, anything that I would say that's the advancement of medicine as we're going forward with the budgie, with birds, and that all areas of anything that we can do to improve avian healthcare in everything from cancer treatment to ophthalmology to dermatology to surgery, diagnostic imaging. The advancement yesterday, we did an ultrasound on a 35-gram budgie and did a liver aspirate on that budgie to try to get a diagnosis. So here we're on an ultrasound machine doing imaging on a 35-gram budgie. And so that just shows you the advancements that we're making. And so the advancements in general avian healthcare will will be beneficial to all of the little budgies out there. And so that's an excellent question. But if I had my wish specifically for budgies, no more cancer.
Okay. Okay. And then I'm going to second that wish with the thought that just because budgies can be, purchased or acquired cheaply, they deserve the same adequate care as larger birds, and people should, they're full parrots themselves with character, and they're the little guys that are amazing.
Yes. They're bigger than parrotlets for the most
true.
part.
Yeah.
Yeah.
And they can talk, and people don't underestimate the fact that budgies have very big vocabularies. If you really listen into those little voices of theirs, they're actually maybe talking to you. So
that's it. In their diminutive voice. There you go.
You say demonic voice or diminutive, because it's both.
Well, I'm sure some are.
Yeah. Well, their voices are so cute. All right. Sorry. I just love budgies.
No.
Okay. So Dr. Tully, once again, thank you for answering so many questions in depthly today. That was, we got through a lot of good information. And before I'm going to announce our winner today, our giveaway winner. I'm going to give you guys a sneak preview of next Friday. We are going to be having a guest. Our guest is going to be Brooke Durham, and she's from SoCal Parrot. She's going to talk about the rescue, rehabilitation, and release wildlife rehabilitation of the parrots of Southern California. So all those parrots that we have flying in the skies at where I am, that we're going to be highlighting those, what species they are, where they came from, probably where they're, all the little wild parrots you see flying out here. And, it's kind of amazing to see them out there. So once again, Dr. Tully, thank you. I'm sure we'll be having some more amazing questions next time around with you. And
well, thank you. I want to thank you, Laura and Brenda Lafeber again, and all of the attendees today. The questions were fantastic. Again, I'm always impressed with the quality of questions and the depth that looking for the information and the depth of information. But it just shows that we have a lot of very knowledgeable and informed bird owners and out there, and I'm appreciative of that. And we continue to do our best to stay up to the expectations.
And I try my best to pronunciate some of these terms, and I appreciate you bailing me out half this time. So
well, Lord, do not feel bad, because I can tell you you get into in front of your peers, and you're at a scientific meeting, and you have to pronounce some of these names. Sometimes I just say the name on the slide. You can pronounce it however you want.
All right, I appreciate that. All right, so today's winner, and I'm going to play a video of what today's winner is going to receive. I'm sorry, today's giveaway. Winner is going to receive. And this is going to be going out to Linda W. You are going to I'm going to do a share screen here. So Linda W, you're going to be receiving a bag of, let's see, Lafeber. We were talking about adult nutrition for parrots. So let's go. It's going to be some NutriBerries. Let me see if I can. There we go. Okay, I'm going to try playing this. Hopefully it. Okay, now I got a weird wand. What did I do? I'm not in it. Shoot.
You're going to highlight it.
Okay, let me try this again. That didn't go so well. Okay, I'm going to move it. Okay. All right, you never know. Live webinars.
Well, congratulations on the win, though. That's nice.
Right? Okay, here we go. Hopefully this will play. There we go. This is for Linda W. And you also get a bag of another bag of Lafeber product if you're in your bird's choice. So we mentioned earlier the hand feeding formula that you can feed to birds no matter what. NutriBerries, birds of all ages can eat these, right? They get it gives an extra punch of nutrition to our older senior citizens, so to speak. So this is what the senior bird NutriBerries have, all that good stuff. Oh, and look at the family farm there. Super cool. All right, that's our product of the month, and that is going out to Linda. Congratulations, Linda. Hopefully your bird will like that heading into the week next week. So, Dr. Tully, once again, it's always a pleasure. And everybody, just want to wish everyone a wonderful weekend. Be safe and all the best to you and your flock. All
And
right.
fall is on its way.
Bye,
Bye.
guys.
Thank you. Thank you
Till
so
next
much.
time.